all my colleagues have made my task very easy. I'll be repeating some of the stuff and showing you probably something new. So, no financial interest. So, if you look at it, they're basically, when you talk of capsular support, and a lot of this session has focused on that, there could be external support or internal. Internal is the form of endocapsular rings, which it started with, followed by Sionis. We've seen enough of that, and now we have the capsule segments, which is what I will be talking about. Externally, you could have the iris hooks, and the newer modification, it's been around for some time now, the capsular support system, which are the commonly known as capsule hooks. And the reason, just look at, when everyone said that they've had problems with iris hooks, we all started with iris hooks, but the reason, if you analyze it, is why the capsule hooks would be better, because there's a shorter return of the hook on the iris hooks. There's an angulation upwards, which leads to a tenting of the capsule edge, and the capsule fornix is not supported. Here, where you see in this case, the capsule fornix is supported also by the capsule hooks. So this is, capsule hooks is my preference now, although I also started with the iris hooks for capsule support. And then the second thing that I would be using are the capsule segments. Kamal touched upon that, and this video very amply shows why I would want to go for capsule segments, because you see this is these are smaller segments. They are actually modified Sionis rings, and they're therefore easier to handle. Sorry, Sionis ring is very flimsy, and surgery can be very tricky. I needn't emphasize this anymore. We just saw Kamal's video. Thank you, Kamal, for that. And basically, you have this flimsy ring there, and you have two proline sutures, and it can be quite a mess. Sionis ring, however, has the advantage of a circular expansion of the bag. Sometimes you need zonular support, maybe weak, and you want all-round expansion. With the segments, that won't be possible, but it can be offset by using an additional capsule tension ring implantation to expand the bag. So we've all been through the surgical technique. So I would just like to emphasize one thing. The section should preferably be made furthest away from the area of subluxation if possible. It may not always be possible. And the viscote layering should be done. Again, Gaurav also, and quite a few people have shown that video. Capsulotomy should be started with the cystosome away from the dialysis. We know we've dealt with it adequately. A word about the placement of capsular hooks. They should be placed after the capsulorhexis. They should be placed through vertical incision. We are used to making the side port, which is quite beveled, but these should be more vertical than the ones we are used to. And we should not over tighten the hooks. The hydro procedure should be gentle, and of course a slow motion phaco should be done. The IL should be implanted with minimal or no dialing. So I think in the interest of time, I'll run through a video. You can see the subluxation here. So this is about 4.5 clock hours of about 4 to 4.5 clock hours of subluxation. So I decided it was a nasal subluxation. I decided to go temporally. Here I've skipped the initial part. The capsulorhexis has been done. We should make a small rhexis, which should be centered with respect to the lens and not the pupil. I'm showing the capsule hook implantation. You can see there's an angulation here. These will go in like a regular iris hook. It's straightened there. And with this rubber stopper, it's tied. Excuse me. So the 3 hooks have been placed. Then a hydrodissection has been performed. And a phacoemulsification, a slow motion phaco is done. And irrigation aspiration should be very careful and very gentle. You can see all this while the 3 hooks that have been placed in this area of subluxation, they're supporting the bag very adequately. So now I plan to use a capsular tension segment in this area. So this is where the maximum, this was the center of the dialysis. I'll remove one hook so that it doesn't obstruct. The other 2 hooks are still supporting. This is the capsular tension segments or ring segments, whatever with their various terminologies now. Essentially a capsular support system. So this is essentially a Sionis with the, you can probably the ends being truncated, so you have a smaller segment over here. You could see that elevated hook. So it comes with a suture which I removed because I'll be using a railroading technique which has been amply shown over here. I also prefer to bend both the needle, the 10 needle, and also the Pauline suture needle, and also the 26 gauge needle which I use to railroad. So railroading has been done here. The second one's being done. The segment is being placed inside. Sometimes it may not be very clear in this video. I have another video which shows the segment more clearly. Is it clear? Maybe the monitor here is not very good. Sorry? Tilt it up? Angle it? Okay, sorry. Anyway, it's fine. So again, you have to be a little slow here. This was essentially this was the first surgery that I did of this segment, and probably now they're being manufactured here. Probably the first one that was ever sent out from the manufacturers. So I'll just proceed a little further. I'll use another video to show how this works. Here you see that the segment is being tightened. Can you see the segment now? Anyway, so it's like tying another Sionis basically. So then an intraocular lens is being, a single piece lens is being implanted, a hydrophobic lens. That's the end of the surgery. Yeah. So there's another case. How much time do we have, Gaurav? 5 minutes?
12 minutes.
With only 10 minutes for the course, and we have one more speaker, so if you'll just finish off in a minute.
Okay, fine. So this was a case where I was doing a surgery and inadvertently caught the capsule and created a zonular dialysis. So this was almost 3 clock hours. I could have gone with a capsule tension ring, but I felt that probably it would give more, it would be more stable, because sometimes with the CTR ring there could be a tilt. The patient was a high profile patient who would opted for a aspheric lens. With the tilt, probably the result may not have been so good, and it seemed comfortable, so I decided to go with the capsule tension segments, capsule segments. So basically these are the segments. Probably appear a little more clearer here. So I'll be doing a railroading here. The important thing is that when the segments go in, the capsule, the Sionis ring, because of its length and the circumference, is a little more flexible. These are not as flexible, so it's important to not pull it inside completely in one go. Rather, and at this point, first through the center of the rexus, first put in one end, tilt it downwards, and then the other one. So that's engaged here. If you pull it towards the end, then of course the circumference is, the arc length is lesser over there. So there it goes in inside the bag, and then it can be pulled and tightened.
Ashu, thanks. I think the message is quite clear. I'll invite the next speaker, Dr. Charu, to the dais, and while she takes her podium,
so just to show them post-op pictures.
Okay.
This is the post-op picture on day 1. Thank you. Thank you.